The question I will be answering today is why is there a shortage of kidney donors in Canada and what is the possible solution to this shortage? So to begin, in 2019, 4,419 Canadians were on a waiting list for a transplant. Of those, 77% were waiting for a kidney. The increased need for organ transplantation is in part being driven by the rising number of Canadians diagnosed with end-stage kidney disease, which went up to 32% over the past 10 years. Last year, there were 555 living donors, which were people who donated a kidney or a lobe of liver, and 762 deceased donors in Canada. The number of deceased donors increased by 56% between 2009 and 2018, whereas the number of living donors remained stable. The number of kidney transplants increases up to 41% from 2010 to 2019. In 2018, Canada transplanted 1,706 kidneys, and as of December 31st, 2018, there were 3,150 patients on the wait list for a kidney transplant. The demand for kidney donors is far greater than the supply. Although there has been an increase in supply over the years, there is a greater increase in demand. When increase in demand is greater, there is a rightward shift in the demand curve as well as a rightward shift in the supply curve. However, it is smaller or less of a shift in the supply curve. This is called an excess demand, or in other words, a shortage, which is when the quantity demanded is greater than the quantity supplied, which is what I explained is happening earlier. The reason as to why supply is increasing in kidney donors, especially in living donors, is because there are multiple hindrances for them. One is that workers who do go through this donation process are not given pay or leave. They're required to use sick leave, vacation days, or employment insurance. This in turn is also another disincentive, as people most likely wouldn't prefer using their sick or vacation days on this as well as their employment insurance. Another reason as to why there may be a shortage in kidney donors is because of the pandemic. On March 16, 2020, the KPD program was put on hold to minimize the possibility of exposing living donors, transplant candidates, and recipients to COVID-19. Essentially, the program was restarted and it affected a lot of the donations that could have possibly happened. On May 12th, Canadian Blood Services Kidney Transplant Advisory Committee, Living Donation Advisory Committee, and the OTDT leadership agreed to restart the kidney paired donation program in 3 phases. A reason as to why we have a shortage in deceased donors is because many don't meet the requirement and are discarded because of mild findings or mid-severe findings. Many marginal kidneys are also discarded, which are all donors older than 60 years and donors older than 50 years with the criteria such as hypertension and cerebrovascular cause of brain death. Some solutions for this problem is one, getting rid of the disincentives living kidney donors face. People who have undergone surgery because of a donation should be given paid leave for a certain number of days that seem appropriate. This is true for 2 reasons. 1, simple fairness to donors, and 2, it would increase the supply of donated kidneys and thus reduce the number of patients prematurely dying from ESRD, which is the final permanent stage of chronic kidney disease. Under the current system, in which compensation of kidney donors is prohibited, each transplant saves taxpayers about $146,000 because the total lifetime cost for treating a transplant patient is far less than the lifetime cost for a patient receiving dialysis therapy, and the government accounts for most of the spending on both. Thus, the government could afford to compensate a kidney donor up to $146,000 and still save money for taxpayers. When given this incentive, people are more likely to be open to the idea of being a living kidney donor. An increase in advertising how to be a part of the deceased organ donor list, as well as being a part of a program as to where you can donate your kidney and to be paired with a patient, would increase the amount of kidney donors in Canada. Many people aren't well informed or educated on how this can be done, and it isn't something that is advertised well in Canada, especially since it wasn't advertised very well that the program was put on hold and restarted. Without it being advertised, how are people supposed to know where and how to be a part of the program and know what to do? It's great that they're starting the program again and doing it in phases, but advertisement is a crucial part that isn't being played.